Now for the next up, we're talking about the pathophysiology of heart failure in children. Pathophysiology. So pathophysiology is you're trying to look at how this disease actually came about. How it came about. Yes, basically, do you understand, in pathophysiology. So for what we have here on how, like, what actually affects the heart to make the heart to stop working properly, is actually three things. All right: preload, afterload, myocardial contractility. That's how the heart muscles are actually, beating. Do you understand? So these are the three things you look at, okay, in heart failure. So what caused the heart to fail? Of course, is these three things. Okay, so let's look at them. For the introduction, we see that if you understand the pathophysiology of heart failure in children, it just involves examining how the heart's ability to pump blood is compromised due to what? Changes in preload. Okay, that's volume of blood in the ventricles at the end of diastole. Changes in afterload, changes in myocardial contractility. That's how the heart is still maintaining its pumping ability. Do you understand? So these three factors directly influence stroke volume and cardiac outputs. So they're actually critical for maintaining the metabolic demands of the growing tissues of a child, especially. A child, the tissues are actually growing very well, you understand? So you want to actually maintain that blood supply to them, So preload is what we start with. Preload is the volume of blood in the ventricles at the end of diastole. So essentially, it is a stretch on the heart muscles before it contracts. Okay. So in children, the preload is influenced by what? Venous return, hydration status, and valve function. So pathophysiology, if there's increased preload, that means it leads to volume overload. Okay. So if the volume of blood at the end of diastole, okay, is too much, okay, diastole, I think that's a relaxation, right? At the end of diastole, if it is too much, you're right, the heart compensates, all right, via the Frank-Starling mechanism, increasing the stroke volume temporarily. Okay, so chronic overload causes ventricular dilation. Of course, if there's too much volume of blood getting into the heart has much more work to do. Do you understand? This can weaken the heart muscles, cause a whole lot of dysfunction. Do you understand? So for the next up, we say that afterload. Afterload is a resistance of the heart. It's a resistance that the heart must overcome to be able to what? Eject blood during systole. So as the heart wants to contract and put out, blood, oxygenated blood into the system, deoxygenated blood into the lungs, there's a resistance. So the heart has to overcome this resistance. Do you understand? So if you have other issues that this resistance is so much for the heart to overcome, all right, then the heart muscles can start getting weaker. So increased afterload forces the heart to work harder, leading to ventricular hypertrophy. So it's just like I'm in the gym, I'm actually doing some 1 or 2 exercise. If, of course, the exercise is too much, all right, my hand muscles will start getting bigger. Do you understand? So over time, this results in decreased compliance, impaired feeling, and diastolic dysfunction. So eventually, the heart fails to maintain adequate output, especially during exertion. All right. So myocardial contractility, we say that definition is the intrinsic ability of the heart muscles to be able to contract independently of preload and afterload. In children, can be impaired by myocarditis, cardiomyopathies, or hypoxia. So pathophysiology, reduced contractility leads to what? Decreased stroke volume and low cardiac output. Now the body compensates via the sympathetic stimulation. Heart rate is increased, contractility is increased, the renin angiotensin aldosterone system is also activated. Okay, so the three mechanisms become maladaptive. They worsen heart failure symptoms like what? Tachypnea, right? Poor feeding and growth failure. Do you understand? So here it's just trying to talk about heart contractility. All right, if it is being affected, then of course blood is not circulating that much again. All right, so that's it.